Hello, this is Jeff. Today I'm going to be talking about KPIs and how effective KPIs can drive understanding and facilitate decision making. I'm going to do this using data about COVID-19 that comes from the New York Times. Before jumping into this data, however, I just want to provide a bit of background about KPIs and what they are. So KPIs, or key performance indicators, are broadly used measures in business and government to drive performance. And a well-designed KPI can be really powerful in terms of driving change and hitting goals. But as the saying goes, you get what you measure. And what that means is that if you're measuring the wrong thing, if your KPI is poorly designed, you will not have positive outcomes. You'll get strange behaviors, unintended consequences, and probably some negative outcomes. So it's important that a KPI is well understood and well designed. So characteristics of good KPIs are that they're relevant and aligned to an organization's goals. They're timely, meaning they've measured the recent past, which is indicative of what's going on in the present, and can help to drive change in the near future. They're clearly defined and easy to understand. They're comparable between entities and over time, so that we can compare, say, a subsidiary in Germany compared to one in Japan. They're verifiable and traceable, meaning that the data comes from trusted sources. The calculations are replicable and the results are replicable. And then finally, they are attributable, meaning that changes in the KPI's values can be traced or matched to specific actions or events taken by an organization or individuals within an organization. When I'm thinking about data and when I'm thinking about designing a KPI, I'm thinking about it really from three different perspectives. The first of those is measures, and measures are formulas. They're mathematical functions. So examples of that are actual sales and budgeted sales. So then you can have comparisons between variance to budget percentage, year over year, etc. The second way I think about it is in terms of dimensions. So we can look at things from a geographical perspective. We can look at them from a product perspective or an org perspective. There are vast numbers of dimensions. The third way to think about data is in hierarchies. So how do you drill from a very high level to a very low level? And an example from the US is when we think about the United States, we think about the country, the US. Then we think about the 50 states. From there, we drill down to the 3,000 counties. Further down would be to cities, to zip codes, and to census areas. Or from a time perspective, we can think about years, quarters, months, weeks, and then days. And to me, hierarchies are incredibly important when it comes to building up analytics because you can follow the path down to revealing data. And from a tabular perspective, you can get down to row-level data with well-constructed hierarchies. And this allows analysts to get down to the truth within hundreds or millions of rows of data. You can get down to the few rows that are really making the impact and really driving the events that are revealed through analysis. So when a KPI is being constructed, thinking about the KPI through these three different perspectives is really important. So now let's move on to the ways in which COVID-19 has been analyzed. So the first measure, and the one that's still most commonly used, is looking at the cumulative number of cases. So from the first case in the US starting in January, we're looking at the total number of cases since that time. And in this view, what we're seeing is circles representing the number of cases aligned to states in the US as well as states or other entities in Mexico, Guatemala, and Central America. And this is useful in that I can see that California has a huge number of cases, as does Texas and Florida and New York, and its second-tier states might be Wisconsin or Minnesota or Washington. But beyond that, I really can't see a lot because this is missing the timeliness element of the KPI. So this is what the first measure that really came out. The second measure that came out was days to double. And days to double really was used a lot early on in the pandemic, say in March, April, and May. As the virus was spreading across the United States, it would hit different states or different counties. And the measurement is intended to show how rapidly cases are growing. And the measure is pick today's number of cases, how many days you have to go back till you get to 50% of today's number, and that's the days to double. So in this example, what you're seeing is New York was faster than every 3 days. Louisiana and California were around 4 days. Washington was around 9 days. And this was really useful when there wasn't a huge base of cases to begin with. So as the pandemic hit new areas, you went from a base of 0. And so getting days to double, you could really tell how quickly it was happening. But in a period when there are thousands or hundreds of thousands of cases inside of a single county, days to double really loses its relevance. And so this is not used so much anymore. Cases per capita is now cropping up more and more. And in this case, we're looking at known cases per 100,000. And this takes into account scale. So what we're looking at here is the populations within a county and how they are measured against the number of cases within a county. So we've normalized cases based on population. And then we can compare a county in sparsely populated North Dakota with a county in highly populated New York City. So this gets to the comparable element of the KPI. But it's still lacking the time element of the KPI because we're looking at the number of cases from the beginning of the pandemic. So in July, Microsoft, in concert with the Harvard Public Health Institute, published a new measure, which was the average cases per 100,000 of population over the past 7 days. And finally, there was a KPI that was comparable, that was traceable, and was timely. And in looking at this, they organized the states into 4 different buckets. So green states, yellow, orange, green counties, yellow counties, orange counties, and red counties. And it was classified by the number of cases per 100,000. So let's go look at that website. So we come out to the website and we're going to switch from the state view or congressional district view down to the county view. And when we do this, we're going to see all 3,000 counties. We're going to see the few that are green, the many that are red, and the others that are orange and yellow. And if I scroll down on the page, there's a definition for each county. So green counties are those that have less than 1 case per 100,000. Yellow is 1 to 9, and really it's 1 to 9.99 cases per 100,000. Orange is 10 to 24.9, and red is greater than 25. So they're really clear, they're really understandable, and Harvard has also published a list of recommendations on what to be done for counties at each level. So this was a great metric, and I really quickly built this into my Power BI analysis. So we're going to come to the Harvard Risk Assessment page. And on this page, I have almost exactly the same view that we saw on the Harvard website. So it's replicated on this map here. But I've added a bit more in. So up above is a state view. So if I want to select an individual state like Texas, when I select Texas, the county level map will drill down just to Texas. And so we'll be able to inspect a bit more closely what's going on in Texas. The other thing that I looked at was the number of counties classified by each risk level. And when I first built this in July, the number peaked in mid-July at around 750 red counties. And so each day I was watching how this number changed. And it was quite interesting to see that by the time we got to August and September, the number of red counties had actually declined, and it hit its bottom at 400. So this was really interesting for me to track mentally. And I got to thinking, what if we were to look at how this average cases per 100,000 was trending over time? And when I did that, it ended up being incredibly revealing. Because in looking at this graph here in the upper middle, and it'll take a bit of time to resolve, but there are 2 things that we're looking at. One is the number of cases by each risk level. So we can see the green, yellow, orange, and red. And then the white line is the average cases per 100,000. And when I saw this, I realized that this provided a means to very precisely identify different phases of the virus. So I call the period from January through March, kind of the pre-epidemic period. We really began to move into the first wave when the first yellow county appeared. And so this was in early March. The first wave peaked in April, and then there was a slow decline through to June, at which point the second wave started. And so on July 1st, which is when I got this, the idea to build this, there were 282 red counties. And over time, the number of red counties increased to around 700. And so this was really interesting to watch. And then we can see that we're documenting the peak of the second wave right here on July 19th. And from that time, there was a decline in red counties till September when we were down around 400. And that's when the third wave started. So the third wave started, and now you can see that more than half the counties are now red counties, and that the average cases per 100,000 for the nation as a whole is 28, meaning the whole nation is at the highest risk level. Over on this side, I've broken out the US into 6 different regions. So the central north and central south, northwest, southeast, southwest, and northeast. And I can select each one of these regions, and then all the data will be showing this one region. So this is really interesting because each region kind of has a different arc on the average cases per 100,000. Yeah. So we only hit 12.5 cases in wave 1, largely avoided wave 2 in the central north area. So this is the upper Midwest. But it's the upper Midwest that is being hit incredibly hard right now by coronavirus, and is now up above almost at 60 cases per 100,000. And drilling down into the central north, we're going to now go look at the state level. And when we drop down to the state level, there are 2 states that really stand out, and those are the Dakotas. So let's see. Drill down. Okay, and so North Dakota and South Dakota really stand out at 159 and 127. Wisconsin is also of great concern right now because when we select Wisconsin, what I see is that every single county in Wisconsin is red. We see that over here on the 100%. So Wisconsin is also really being hammered. And then Milwaukee County, which is where the city of Milwaukee is located, stands out as by having by far the most cases overall. Now this profile, this really sharp rise in the past couple of months, is much different in other regions. And the biggest difference comes when we look at the Northeast. So the Northeast region, New York, New Jersey, is where the virus first really blew up. And this was because travelers were flying from Europe into the big cities in the Northeast, particularly around New York. This wave also hit Detroit and Chicago, I think, for the same reason. But you see that it peaked at 25.8 early on, and then was really low coming through the summer, and only rose up to 18.3 most recently. So, compared to the upper Midwest, this is still really low. Another way that I was looking at this was at the risk by day. And I want to explore this using a couple different sheets. This one is very similar to what we looked at before, but we can pick out different days. So let's drop back and just see how the counties change their risk level over time. So we'll come to early on in the pandemic, and there's a couple things to call out. So one is that when it resolves, we're going to see that the majority of cases were yellow and green and very few orange and red back in April. And that the population of the cities that were red was really big, 476,000 people averaging per county. And if we jump ahead and then the map will show us that getting hammered hard in New York, these rural counties in Georgia were hit hard, Louisiana, and there's some counties out in the west that are actually quite fascinating. So we look in Idaho, there's one county right here, Blaine County. We look in Utah, there's Summit County. And in Colorado, Eagle County. as it happens, these are ski areas. So this is Sun Valley, this is Park City, and this is Aspen, and a couple others. So these small counties were hit hard because travelers were flying in from the East Coast to go skiing and bringing the virus with them. This is a really interesting feature of the first wave. Now, the second wave peaked on July 19th. So we come out to July 19th. It's a much different picture. Here's where we're going to see the virus spread all through the South. And that it was these southern tier states that were hit really hard. So it's a huge difference, right? The whole Southeast is really hammered quite hard, as is Southern California and Arizona. And that the number of infected counties, 2,800, red counties on the 19th are 642. A few days later, they rose up to 750. And that the cases per 100,000 is at 20.5. Now, I didn't show that number, I didn't mention that number earlier on, but if we come back to early April, we're going to see that this drops to below 6 or 8, right? So it's a much lower number. But if we come out to the present day, so we'll pick 11.4, again, it's a much different view. One, the number of red counties is now almost 2/3 of the counties in the United States, and it's covering the whole central portion of the U.S. Interestingly, the South is having gone through the second wave quite harshly, is not nearly as hammered as it was in July, but the central part is really looking horrible, and now we have cases at 28 per 100,000. Another way to look at this is to use a per capita by day. So in this one, I have a bubble chart where on the horizontal axis, we're looking at per capita daily cases by day per 100,000. The vertical axis is daily deaths. And there are some really interesting things to pull out here. So when we look at the peak of wave 1, we're going to see that the deaths per 100,000 on a daily basis in New York were at 5.8, much higher than anyone else, followed by New Jersey at 2.7. The wave 2 peak, a whole different range of states are now on the upper end. These are the southern tier states that we just saw earlier: Arizona, South Carolina, Mississippi, Florida, Louisiana, Alabama, Texas, Georgia, Tennessee, Idaho. So these are the highest ones. But if you look at the daily deaths, they're not 6, they're at 1.3 is the biggest in Arizona. Wave 3 peak, again, completely different. Now these are the Great Plains states and the upper Midwest states, North Dakota, South Dakota, and Montana, stand out by far as being quite high up on the scale, but the scale is still pretty low, 1.4 to 1.8. When we drill down, however, let's pick South Dakota. When we drill down into South Dakota to the county level, some real variation jumps out here. So now what we're seeing is that some counties are at 24. This is Walworth County. Turner County is at 14. Campbell County at 11. So what's happening in these counties that have very small populations is that the minimal health services that may exist in these counties are overwhelmed, and they're not able to handle the influx of cases that they're seeing, so they're really getting nailed pretty hard by it. And this is really concerning because it's paired with behaviors that are not exhibited in other places, particularly on the coast, where people, I think, are adhering more to the rules of COVID, which are wearing masks, social distancing, and not gathering in large groups. And it's those behaviors that I think are really driving those super high concentrations. And one thought is that the Sturgis motorcycle rally, which took place in early September, I think has really driven this influx of cases across the Midwest. And the final type of analytic that I want to share is Sandance. And so Sandance is a visualization that's produced by Microsoft Research, and I really appreciate it because I can spin through data very, very rapidly with Sandance. So in this view, we're looking at all the counties in the U.S. Along the vertical axis, we're looking at the percentage below the poverty line The horizontal axis is income per capita. So wealthier is farther out to the right. Poorer is is higher up, right? So that's why you get this arc. And in the wave 3 peak, what we're seeing is kind of medium income per capita, but with very low poverty. So that's the wave 3 peak. The color is average cases per 100,000. So this is where you're seeing a lot of infection here, and these are the Midwestern counties. Wave 2 peak is different. And in the wave 2 peak, what we're seeing is that the infections are in poorer counties, those that are spread across the South. And finally, the wave 1 peak really hit wealthier counties, the big cities along the East Coast, and well, Aspen, Sun Valley, etc. Right? So each wave has a really different profile. Another way to cut this is to essentially recreate a map. And so I'm going to come here. Actually, I'll just change it live. So what I'm going to do is I'm going to change the x-axis to longitude, the y-axis to latitude. Okay, and I'm going to go to a 3D view. And let's look at this by, we're going to color this by the percentage of the population in a county that is white. So that in the US Census identified themselves as white. I'm going to change the color back to red-blue. All right, so now in wave 1, here's where you really see the hit on the East Coast, those East Coast counties. What comes out when we scroll down are these counties in Georgia. And then this should be Blaine County, Idaho, but let's double check. Okay, so I select this, I'm going to come to details, and it is Blaine County, Idaho. So what this is showing is that this tiny little county with a population of 22,000 was also hit quite hard. Right? Now let's change to wave 2 and see what happens. Oh, but the other thing to call out here is that the counties that were most severely impacted were those that had the lowest white populations. So in wave 2, we get a different view, particularly from a geographic perspective. So in wave 2, we're going to see along the southern tier is where counties get hit really hard. Right? So this is down in Florida, in Texas, in Alabama, Louisiana, Mississippi. This is where the big hits were really happening, and in Southern California. Wave 3 is where we are now, and this is where the Midwest is really jumping out as having the highest level of infections, but it's also where the concentrations of white populated counties are highest. And so now it's clear that the virus has not only moved to a new geographic area, but it's moved to a new segment of the population that had not been hit hard, which is counties with majority white populations. And I think there are a lot of political and economic dynamics that can be considered when we see the virus move from the coasts and from largely non-white populations into the center of the country to largely white populations. That's just food for thought. So at any rate, this is how I've been analyzing COVID-19 and really focusing on the average cases per 100,000 because it is so revealing about what's going on with the virus in the United States. I hope this has been interesting. Thank you.